In order to stay alive, the body has to breathe air. We breathe in oxygen and we breathe out carbon dioxide. This process is known as respiration. Breathing happens automatically. Every day, the body breathes about 20,000 times. By the time we reach 70 years old, that's about 600 million breaths. All of this breathing occurs because of the respiratory system, which includes the nose, throat, voice box, windpipe, and lungs. At the top of the respiratory system, the nostrils bring air into the nose, where it's filtered, warmed, and moistened. Tiny hairs called cilia protect the nasal passageways and other parts of the respiratory tract and filter out dust and other particles that enter the nose through the breathed air. Air can also be breathed in through the mouth. The two airways of the nose and mouth meet up at the pharynx, which is located at the back of the throat. The pharynx carries both food and air and is used for digestion and respiration. One path is for food. This is called the esophagus, which leads on to the stomach. The other side is for air. It's called the trachea. A small flap of tissue, called the epiglottis, covers the air-only passage when we swallow. This stops food and liquid from going into the lungs. The larynx, or voice box, is located at the top of the trachea, the air-only pipe. This is where our vocal cords are. The trachea, or windpipe, which is a 2 to 3 centimetre tube, then extends downwards from the bottom of the larynx for about 12 centimetres. The walls of the windpipe are made strong by stiff rings of cartilage that keep it open. The trachea is also lined with tiny hairs. They sweep foreign particles and fluids out of the airway, keeping them from entering the lungs. The windpipe divides into 2 branches, and each one of these enters one of the 2 lungs of the body. Each branch resembles the limbs of a tree, dividing into smaller, finer branches called bronchioles. The bronchioles end in tiny air sacs called alveoli, which look a bit like grapes. These structures enable fresh air to get to the air sacs, which are surrounded by tiny blood vessels, or capillaries. The oxygen passes through these air sacs and travels through the capillary walls into the bloodstream. At the same time, carbon dioxide transfers from the bloodstream into the air sacs, where it gets breathed out of the body.
Hi, doctor. How are you? I'm okay, but I have a really bad cough.
Okay. Are there any more symptoms that you have?
The cough is really phlegmy, and sometimes it's hard to breathe. And I also get an occasional fever with a chill.
Mm-hmm. Okay, so it sounds like this may be pneumonia, but I won't know until we do tests, until we do a chest x-ray. But you have to set an appointment for that. For now, I'll prescribe you Benylin, which is a cough medicine, just to control it.
All right.
And so you just take this to the pharmacy and they'll give it to you.
Okay, sounds good. Excuse me.
I'll see you
Okay.
for your appointment.
Okay, thank you, doctor.
You're welcome. Have a good day.
Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. If you have lobar pneumonia, one lobe of your lungs is affected. If you have bronchopneumonia, many areas of both lungs are affected. Pneumonia may cause the following symptoms: difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. Pneumonia can lead to serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. Bacteremia occurs when the bacteria causing your pneumonia move into your bloodstream, where they may travel to infect other organs. In some cases of pneumonia, a large collection of fluid and pus, called an abscess, may form inside one of your lungs. If an abscess forms around the outside of your lung, it's called an empyema.
At first, COPD may cause no symptoms or only mild symptoms. As the disease progresses, common symptoms include shortness of breath, wheezing, and chest tightness, especially with exercise, and an ongoing cough, often with a lot of mucus. As COPD symptoms worsen, breathing requires much more energy, and it can get harder to exercise or do routine activities like getting dressed or climbing stairs. This may lead to fatigue, weight loss, and muscle loss. People with COPD can experience a variety of symptoms. Different stages of COPD range from mild to moderate to severe. In normal functioning lungs, when air is inhaled, it travels down the windpipe and into the airways, or bronchial tubes, of the lungs. Inside the lungs, the airways branch out into smaller and smaller tubes called bronchioles that are rich in blood supply. At the end of these tubes are billions of tiny air sacs, called alveoli. Normally, the walls of the airways and air sacs are elastic and flexible in nature. Inhaling causes each air sac to fill with air. Exhaling causes each air sac to deflate. Efficient uptake of air into the lungs provides oxygen to the blood, which is then carried to all parts of the body. In COPD, however, the airways become thick and inflamed, and they produce more mucus than usual. This mucus can clog the airways and makes it hard to breathe. In COPD, the walls of the air sacs in the lungs are damaged and lose their elastic quality. The air sacs get floppy, broken, and lose their shape. As the air spaces get larger, air gets trapped, and there are fewer air sacs to supply oxygen to the blood. Because air is trapped in these air sacs, it is difficult for lungs with COPD to deflate like normal lungs. This trapped air makes it harder to get fresh air into the lungs and makes breathing more difficult. COPD is the third leading cause of death in the United States and affects more than 13.5 million Americans. It is predominantly diagnosed in middle-aged individuals older than 40 years and is present in both women and men. Although COPD is more common in men, more women die from this disease each year than men. The rate of COPD continues to increase worldwide due to smoking and worsening air pollution. While there is no cure for COPD, you can take steps to feel better, stay more active, and slow disease progression.
Influenza, commonly known as the flu, is a highly contagious respiratory illness transmitted from person to person via droplets and small particles produced when infected people cough or sneeze. Influenza is also transmitted via hand contact with contaminated surfaces. Influenza symptoms include high fever, a dry cough, headache, sore throat, muscle and joint pain, and feeling unwell. There are 3 types of influenza viruses that cause infection in humans, types A, B, and C. However, types A and B are the overwhelming majority of flu viruses that humans are exposed to. Influenza viruses are unique. They experience high mutation rates and constantly change, creating new strains. Because viruses mutate frequently, new vaccines that best match the strains predicted for the coming influenza season are prepared each year. Influenza can affect anyone. People at highest risk include those aged 65 and over, pregnant women, Indigenous people over 15, young infants, and those living with chronic conditions. Up to 3,500 older Australians die from influenza-related complications each year. Vaccination is your best defense against influenza. Talk to your doctor to learn more.
Treatment options for cancer include local therapies, such as surgery and radiation therapy, and systemic therapies, such as chemotherapy and targeted therapy. You may receive one or a combination of these treatments. There are several surgical options, depending on the type and stage of the cancer. During a wedge resection, or segmenectomy, the tumor and a small margin of healthy tissue are removed. In a lobectomy, or sleeve lobectomy, one lobe of a lung is removed. During a pneumonectomy, the surgeon removes the entire lung. In a sleeve resection, a diseased section of a large airway is removed, and the healthy ends are reattached. During any of these procedures, your surgeon may remove lymph to check them for signs of cancer. Radiation therapy, or radiotherapy, is a local treatment that uses high-energy rays to kill or shrink cancer cells to relieve symptoms. External beam radiation therapy is directed at the cancer's location from a machine outside your body. Brachytherapy, or internal radiation therapy, often in the form of pellets, is most commonly used to help relieve blockage of the large airways by cancer. Chemotherapy is a systemic treatment that uses drugs to stop the growth of the cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body. Targeted therapies are newer cancer treatments that work by focusing on specific genetic abnormalities of cancer cells. One targeted therapy, bevacizumab, starves the tumor by stopping it from creating a new blood supply. Another targeted therapy, erlotinib, stops tumor growth by blocking the chemicals that signal the cancer cells to grow and divide.